They're big problems. And what we really are hoping to do in working with these companies is to find ways that we can make care more accessible, more affordable, and deliver better outcomes. We focus on technology enabled services. We've done healthcare information technology in the past. And what we found is that so much of where healthcare is needed is really once you leave the office, once you're discharged, you live with a condition, a chronic condition 24 by 7. How can you actually do so in a way that gives you the type of support and guidance that you need in order to live better with that condition?
All right, I'm joined today with Lee Shapiro, the managing partner of 7Wire Ventures, one of the country's most respected venture capital firms with a keen interest in healthcare IT. And Lee is also someone with a remarkable background in healthcare as the former CFO of Livongo and former president of Allscripts. So we are very lucky to have you today, Lee. Thank you for joining us.
Thank you. Well, I didn't realize I'd be also wearing the former Allscripts gear for the conversation. Thanks, Roy, so much for hosting me today.
That's the reality of a podcast is anything is fair game, because you have enough time to explore. So I'm gonna start by asking you a few questions about your current role. And let's start with the theme of your investments. So I couldn't help but notice all the different board positions that you have. And I imagine a good number of those board positions came with investments: Parsley Health, Override, Folks Health, Hazen, Click Therapeutics, Jasper, Clover. Is there a theme to where you like to invest and where you like to participate as a board member?
So, 7Wire Ventures is focused on supporting companies that are helping to address the challenges we all face as consumers of healthcare. Our thesis is that we want to build better informed and connected health consumers. And each of those words was chosen quite carefully. If you notice, we say health, not healthcare, because as consumers, what we want the outcome to be is to be healthy. When you think about healthcare is a business that's providing services, but yet, given the choice, Roy, you and I and those listening to us today would probably not want to get healthcare if they're feeling well. You wouldn't spend the night in the hospital as opposed to spending the night in a hotel if you were going on vacation. So what we're trying to do is reinforce doctors' orders, if you will, help individuals follow what it is that their doctors have suggested that they do, whether that's being adherent with their medications, whether that's managing their diet or their exercise or their sleep, whether it's navigating through a complex regime of care associated with a cancer diagnosis, or if you have a complex chronic condition like Crohn's or colitis, you need support in doing that. So we help people get the support they need while they're still engaging in their day-to-day activities and hopefully being able to live healthier lives because of it. The second part of your question was around where, I spend my time. And you mentioned a number of the companies. I serve on the boards of large portfolio companies like Transcarent, which recently acquired Accolade and now is 500 plus million in revenue. And then down to companies like Override and Jasper Health, which are still earlier stage companies and sub 10 million in revenue. And for me, it's about where we can add value. It's about where our time can really be working with the leadership team, with the founders, and help them drive their vision forward in order to build something that can help people in a meaningful way.
I will double back to that concept of value in a second, but just to sort of reiterate what I'm hearing you say, it's foundational elements within healthcare and health. And as I apply that framework to some of these companies, certain words start to surface for me. Take tech-enabled holistic primary care. I imagine a lot of that is enabling prevention, virtual care in behavioral and mental health, concepts like access, and then Payzen, the concept of affordability, and then Jasper with a focus on cancer care navigation. And so what I see is foundational verbs that are problematic, particularly for patients and companies that are trying to target those core issues head on. Is that a fair description?
It's a great summary. And, for us,
Let's call it this: the big problem.
they're big problems. And what we really are hoping to do in working with these companies is to find ways that we can make care more accessible, more affordable, and deliver better outcomes. And there's a lot of organizations who have similar goals and objectives. We focus as a fund on technology enabled services as the entry point in terms of doing that. So we're not traditional medical device investors, life science or biotech investors. We've done healthcare information technology in the past. Most of what we were doing in those worlds was around how we could help providers improve the delivery of care inside a hospital or a doctor's office. And what we found is that so much of where healthcare is needed is really once you leave the office, once you're discharged. You live with a condition, a chronic condition 24/7. How can you actually do so in a way that gives you the type of support and guidance that you need in order to live better with that condition? So that's how we see that support going.
That theme, would you say, Lee, that your companies have historically focused on a B2C or B2Patient, B2P business model, which I always think of as the hardest hill to climb in healthcare, convincing end user patients to do affect their behavior, their choices. So much of healthcare is recurring in nature. So now you're talking about habits as opposed to one-time episodic events. You don't need a patient to show up at a store and buy a dress or a pair of pants. You need that patient to show up at the store every day and invest in certain behavioral patterns. Has that been a recurring theme, this B2C outreach, and what's worked, what hasn't worked, if that's the case? I always think of B2B, strategic relationships, referral patterns, partnering with a hospital as almost a hack, a circumvent around the difficulty of convincing patients to change behavior. It makes life easier for a business to think about partnering with CEOs versus convincing 1 million patients to change their behavior. But that's not always an option if you're targeting the hardest aspects of healthcare, which typically fall around patient behavior. So is that a fair description of sort of another area of focus for you, changing and
Well,
influencing
actually,
patient
it
behavior?
is, yeah, it is the area of focus. Let me take a step back because when we
And I
think
know
about
Livongo is a perfect example of that
a great
because it was
example of that,
all about patient behavior and diabetes.
very much so. And it's a similar model that we've deployed before and after we did our work with Livongo. Let me take a step back because the way in which we think about the types of companies we'll support comes back to some proprietary we do around understanding the consumer journey. So, what are the challenges they face in achieving the health state that they want? And how can a given offering from a company help address that problem? Oftentimes, we're working closely with founders who are ones who've had lived experience. They've been in a situation where they've actually dealt with this type of challenge themselves, and they're inspiring others to not go through, or they're inspired by not seeing others go through what they went through. And so, first and foremost, when we look at a given company, when they come forward, or we meet with them, or we think about starting a company, what we do is we look at that challenge that a consumer has, and we literally will map that journey. How complicated is the challenge that someone is facing? And there's a group of theorists that have done something around what's called jobs to be done theory, the most famous of which is the late Clayton Christensen from Harvard. And when you look at what a given
This is the innovator's dilemma, Clayton.
the same person,
Probably the
and when you
best business book ever written.
and fantastic book. And so what we try to do is say, if you can give a consumer value and they can see that whatever challenge they're facing is one that you're addressing for them and you keep giving them value, they keep coming back, right? And so you use the application when you're trying to solve the problem. So when you were going to the airport today, I don't know whether you took a taxi or an Uber, but you think about people didn't have trouble getting rides. They could walk out on the street, they could flag down a taxi, harder to do if it's raining, not necessarily sure you're going to get someone whose cab you enjoy being in. You can't necessarily choose the type of vehicle. Uber helped address those problems. And in an area that I would say was not life altering, but certainly improved on a process that was challenging before. Now you come to healthcare and you say, if we can deliver, and this is kind of the primary focus of the companies that we work with, if you can deliver an offering that's addressing a major pain point for them, then they'll keep coming back and you have to deliver additional value. So Livongo, you mentioned earlier, many pain points and challenges for individuals who had diabetes, or most people, because still continuous glucose monitors are somewhat a minority of the population who have diabetes are using them. The vast majority are using a glucometer. It is not a connected device. It will capture information about your blood sugar levels after you've pricked your finger, put a drop of blood on it on a test strip, and then stick it inside that device, and it will measure your blood sugars. If you're a compliant patient and you bring that with you to your doctor's visit every 4 months, every 6 months, and you meet with your provider for 10 or 15 minutes, maybe 20, and they're trying to ingest all that data, how are they going to be able to give you great guidance? They might say, well, we see that you had this trend over this period of time. We'll adjust your medications. What if, though, every time you tested and you looked at the device, you were getting insights and knowledge about how you might want to modify your behavior? Maybe you need some help with diet. Maybe you need some medication adjustment or like. If you can keep people in range, so stop them from being hyper or hypoglycemic, too high or too low with their blood sugar, you can impact a lot of people in a very positive way. And so that was the thinking behind Livongo, which is give people a service that gives them value. And every time they test, they're actually excited to see what new insight they're getting and how they might be able to improve their health and see what kind of progress is being made.
It's interesting because we see different end users that fall into different place or spots within a linear progression of urgent need, depending on how acute and chronic their conditions are. So you start at the very bottom with the average person who is not suffering from anything chronic, and how do they go about living their life in a way that's preventative optimized, meaning highly aware of any conditions that might be developing, but haven't necessarily converted into an actual healthcare issue, addressable issue. And so I think that's probably the lowest need spectrum. And you see a very small cohort of citizens, at least in this country where I interact most frequently with, who actually take steps to engage with the consumer marketplace, with companies in those kinds of products. The individuals who wear those electronic rings, engage with electronic watches, and really monitor their sleep, monitor their cardiovascular behavior, monitor all kinds of elements within their life. There's a tiny cohort. I would call it, I haven't done the analysis, but I'd be surprised if it's more than 1% of the population. And then as you climb the line graph towards individuals with diabetes, individuals with chronic heart conditions, individuals who are suffering from cancer, then you get a lot of buy-in, right? I want the best products, whatever it takes, and I'm going to change and modify my behavior to maximize my chances of survival. Is that a fair description of where the marketplace is today? And where I'd love to see is that bottom portion of that line rise and meet the high portion of that line over time, so that everyone takes preventative care as seriously and has the tools they need to engage in preventative care on a daily basis. Sort of
So
where we are versus where I'd like us to be.
Yeah, I think you're describing populations and segments. I'm not sure I subscribe to the low number that you attributed to those who are, I'd say, more quantified self engaged in measuring certain aspects of their health. I think the number may be higher, but the point you're making is really emphasizing what I was saying before, which is people will use an offering or a solution if they see that it's able to help them address a problem they're facing in their life and
A
do
real
it better
problem.
than the way they were doing it before. There is a notion around change management that's really important here, because people are hesitant to change unless they really have something that's driving them to do something better than the way it was previously. And so you have to either remove some friction or you have to find a way to kind of draw people in terms of a magnet towards something that's better. I think that when you're dealing with individuals who have chronic conditions and they recognize that there are ways in which they're trying to manage that on their own today, and if you can give them a guardian angel that sits on their shoulder, so to speak, that comes through the technology that's being delivered, that can help them live healthier, that they'll adopt that because they can start to see the improvements that are occurring in their health. And your question leads to kind of the second of three principles that we have. One, I mentioned the engaging consumer experience, give people something of value that improves over the status quo. The second is that you need to improve outcomes in a measurable way. So you have to show that there's progress being made. Someone might like something better, but if you're not really moving the needle on improving outcomes, then your company is not having the type of impact that's going to allow it to meet the third step, going way back to your question about business model, B2B versus trying to do what most of our companies do, which is B2B2C. You have to create a return on investment to the ultimate buyer. The buyer is who's ever at risk for the cost of care. Roy, as you know, we're in a circumstance where, as consumers, we don't pay the vast majority of the cost of our care. We pay an out of pocket, we pay a deductible. That can be very meaningful at a personal level. But yesterday, I was with someone who was telling me about a heart condition they have and a double bypass surgery and a variety of other complex treatment that they receive. Her healthcare bill now tallies at something over $5 million for all the care that she received. And she's fortunate that she had great insurance that was able to cover that cost for her. So whatever that solution is, needs to recognize that the cost is being borne by a health plan, a self-insured employer, the government, and that you have to deliver a return on investment to them. At the same time, you're driving utilization of this offering by a consumer that's seeing a measurable difference in their health, and therefore they keep using it and continues to provide in a virtuous cycle of value to who's ever paying the bill.
I'm glad you brought that up because it's another question that I have, Lee. Again, from your vantage point, I call venture capital the place for optimistic private equity investors who have a more rosy perspective on what's possible in terms of change. So, I bring more of maybe a questioning. I don't want to say cynical, but a more mixed view of change. And I'm not sure which one of us is right. So therefore, your insight is really helpful. But let me test it a little bit. So just the concept of cash versus payer. My anecdotal exposure to early stage wellness orientated, preventative orientated consumer products is that they tend to fall back on a lot of cash-based solutions, patient funded. And I think there's a reason for that. They would surely love to protect the end user from, the cash outlay and ride the payer wave, whether it's government funded or commercial or alternative. But they find that the speed of change in technology driven products is out of sync with the speed of adoption from commercial and government payer options. And so they need to move quickly. Here's the product. It's $50 a month. Take it or leave it, Mr. Mrs. Patient. And that is a harder hill to climb because patients have been educated and trained in this country to have someone else pay for their health. Wrapping all of that into a question for you. As you look at your portfolio today of consumer goods, what percentage is paid for by a payer versus by the patient? And do you think about your investments from that perspective too, and sort of have a bias towards one versus the other?
So we do tend to have a bias towards offerings that are sold to the large at-risk organizations. So at-risk medical groups, payers, government, self-insured employers, as opposed to consumer pay. Some of our companies have a consumer pay component, but they're moving towards getting enough data and adoption where they can prove value to health plans and go in network and get reimbursed for the services that they're providing. But The model of selling direct to consumers has the challenges, Roy, that you noted. It's also kind of creates a bit of a digital divide. So those who can afford it might say, well, gee, I'll pay to get my new wristband or my new ring, or I'll pay to get this service. I'll go online and I'll do this testing and I'll buy these supplements. But that's out of reach for
Negative
many.
PSA to call to
Uh,
PSA call
so we
to.
have to find a way to help improve accessibility and affordability of care. As I mentioned, that's part of where we spend a lot of time thinking about level of impact we can have. And so we're not just trying to cater to the few who can afford it. What we're trying to do is think about how can we have broader impact so that those who have a skin condition like psoriasis, 35 million people in the US have psoriasis, and then there's eczema, there's vitiligo and the like. How can we provide ways for them to access care in a way that's meaningful through them through a virtual dermatology offering like one of our portfolio companies, Zygo, provides? And it's not just intended to be for those who can afford to pay for it out of.
As you think about the different payer cohorts, do you have a bias there too? And I would think, as an outsider looking in, again, anecdotally, that the self-insured employer space would probably be the richest vein or market to focus on for new solutions. They view themselves as the ultimate underwriter. They're interested, heavily interested in the health of their workforce, and they're used to moving quickly because they are large employers that compete in many cases, competitive marketplaces. So there's sort of a cultural fit there as well. Am I reading that correctly, or you're finding the same speed of adoption in different payer cohorts, and it varies based on other considerations?
Well, healthcare moves at a glacial pace.
Okay.
So employers do tend to move more quickly than what we see health plans and at-risk provider groups move. But I think oftentimes our companies will start with employers and then move into relationships with payers. And that happens. It was actually part of the strategy we had at Livongo. By gaining employer adoption, many of these employers use large health plans as their third-party benefit administrator for their employees. So the health plan becomes aware of the offering. It starts to learn about the results that we're delivering for the self-insured employers who are traditionally their national accounts. And then they start to look at those offerings and say, how can we adopt it for the balance of our population in commercial insurance, or to the extent that they have a Medicare Advantage plan and it appeals to those over 65, can we now adopt it as something that will help us provide better care and save cost for a population that we have capitated risk for? So employer adoption is oftentimes an entryway into the health plan. And then with regard to value-based care relationships with at-risk medical groups, that also can be a pathway, but tends to be a little bit slower and also smaller in terms of the way in which it operates.
I think that's a really interesting point. So I love two-step business models, low barrier to entry, which creates a platform for you to enter a high barrier to entry market. So I think that's really insightful. Thank you. Question that I've always had about venture capital, and as you can tell based on these questions, it's venture capital is a little bit of a get to know for me. I've spent a lot of time with private equity over the years. So I always look at venture capital as this cousin of private equity that speaks maybe French versus I speak English, or I speak French and you speak English. So it's always interesting to try to get a feel for it. Here's a question that I wrestle with. How do you know that you're backing a management team with financial discipline if you're investing in a company that historically loses money, but generates top line growth, generates adoption, but loses money? And so for us in private equity land or mature company land, hey, you don't have a comparable margin to your peer group. You're financially undisciplined. It's pretty simple. I think in your case, it's probably a lot more complicated, nuanced to reach that conclusion. And yet financial discipline in a management team is critical. So what are the tools that you use to reach a view on that?
So for us, it may be even more complicated than you're thinking because our focus is on seed and Series A companies. So we'll invest even before a company has revenue. And so there are two parts to your question. One is about founder fit, and we do a lot of work in terms of understanding founder kind of how, how successful that founder might be in helping to build that company. And then the second is a business model question. So tackling the first part of it, we look to see, and this is maybe unique to us because other companies in venture invest at later stages or may have a different philosophy. But first, we look to see if there's a founder market fit. So no offense intended, but sometimes we'll see a male founder trying to create a women's health company. And I think it's a little challenging if you don't understand the lived experience because women are not little men or equal in terms of the way they present with healthcare problems. And so, you would say, well, that might require a lot more diligence from us to understand what is the unique insight and why is this particular founder going to be able to make a go of it in a space where he or she may not have the right lived experience. We look at attributes like resilience. What types of challenges have they overcome? Because building a company is hard. We've done it. We've all on our team, we've all operated businesses, we've built businesses. Trying to get to scale requires a degree of mental flexibility and willingness to learn and adaptability. And there are some founders who believe that they have all the answers, which they may very well have. We look for ones who are willing to learn from the mistakes that we've made building businesses and have some coachability around it. We've spent a lot of time leveraging tools from books like Attributes by Rich Diviney. He was a Navy SEAL recruiter, and he looked at the types of skills that were required for a member of a SEAL team, as well as leaders of SEALs teams. I mean, there are different skills between what you need for someone who's going to be able to do a certain task and someone who's going to lead a team that's going to conduct certain types of operations. And so we use that framework as a way to start to assess a founder and the leadership team around her. Let me just pause there and see if you've got questions before I come to business model about financial discipline and ability to kind of achieve positive margins.
Keep going. That was great.
So on the business model side, we recognize that there is an investment period that companies go through, that they're not going to have a business model from day one that will necessarily generate positive cash flow. And the first money that comes in is going to be the last money that comes in. That rarely happens in the business that we operate in. We look to see where do we believe that business model can grow over time. So, for example, you might early on have a high degree of service while you're learning about how to deliver the service. And then you can interject technology in order to be able to provide better ways in terms of interacting with an individual that helps support her or him, but doesn't require as much face time, if you will. There are businesses that have had health coaches. We've had very friendly health coaches who've been willing to sit on the phone and talk with people for 45 minutes or an hour. That doesn't scale very well. But as you start to learn about what people's needs are, you can start to anticipate questions. You can interject technology when someone's reaching out for a question, they text you something. You can have your machine learning, I hesitate to say AI, but you can have your algorithms respond and provide someone with really great feedback based on all the experience you've had in the business and driving opportunities to leverage those insights in ways that can help many people. And now you can scale the use of that health coach. So instead of serving 20 people, they can serve hundreds of people in terms of their work during the course of a day. And so that's the way that we think about these businesses is where can there be scale economics and how can we build to that over a reasonable period of time? And what do we believe it will take in terms of capital to get there?
So shifting to the concerns, the risks that you worry about time and time again, because you have such a deep library of empirical case studies that you've experienced, and so you can run statistics in a way that maybe the average AI tool couldn't right now. It's an interesting question: humans versus AI. Who knows more ultimately? Your experience of things that don't end up working over time, and maybe moving beyond round A to round C, D, E, and going public, but thinking about the history of a company measured in decades. I'm intrigued by your role leading Allscripts for the years that you did, because that space feels like, Columbia, Harvard, Wharton case study. Who wins? Game theory, Epic, Allscripts, Oracle, Cerner. Heavy acquisition, low acquisition, multitude of outside ownership groups, singular ownership group, hospital focus, outpatient focus. And then you have the larger ecosystem of new entrants because there's new technology. Best example last few days is scripts, ambient AI acting as automated script taking or note taking. And Epic announces that it's moving into that space in the last 72 hours, and all the 100 new entrants that are VC well funded start to write their own obituaries. It's over. Healthcare is full of these sort of somewhat dormant but large, mature companies in technology providing so-so solutions. You would think when push comes to shove are not going to give up their core client base and will replicate and compete away through their incumbent client relationships, new entrants. So that's just sort of one risk. Then another risk I would worry about investing in round A is regulatory change. Are we doing telemedicine virtual care? Well, in 2020, cross state lines, we are. Government and state government has our back, full support. By 2022, 23, not so much. Let's go back to the rigidity of just because you provide virtual care in California doesn't mean we're going to allow you to provide it in Texas, which slows everything down. And so I just think about those are just two examples of these large bubbles of unknown risks that can affect any one of these new entrants. Which of these bubbles do you think about more often, most often? Which have caused you the most trouble over the years? What's hurt you the most repeatedly?
Well, I think that as much diligence as we do in terms of working with founders and trying to understand their motivation and their ability to lead and grow businesses, we have
If you're going
found
to
that
count
we've
read
been
zone 6,
challenged
zone 7, and zone 8, it
sometimes
is highly
with
likely that
the
we will have
right
to gain check
leadership
your
team at
bag
the
when it's
right
your time
time
to
for where a
board.
company is in its evolution. And
If you're going
so
to pass read zone 6,
many
zone
times
7, and zone 8
the
next to your team
opportunity
member and
is
grab
right,
a
but
broader
we don't
bag,
have the right
please
team.
come to the podium now.
And
We
I
will
think that
have to
one of
gain
the
check your
things
bag
that
once
we've
again. If you're
learned
going to pass
is
read zone 6
there's a
to
need
zone 7
to
and zone 8 and
move
have
more
a
quickly
roller
when you
start
know
on
that
bag,
that's the
please come to the
case
podium now. We will
and
have to
do
gain
the
check your
work
bag.
that's
Thank you.
necessary in order to make sure that you have the right people on the bus in order to take the business forward. That we see quite a bit in early stage companies where, the founder's able to take the company so far, but you really need a different skill set in order to grow it and go beyond. Regulatory risk is less of an issue for us. As I mentioned, because we don't invest in life sciences or medical device, there are years that it takes to get regulatory approval. That's less of an issue. And in some ways, we've always seen regulatory as being a tailwind for some of our businesses. In the electronic health record space, when we were building Allscripts, the government started a program to reimburse for electronic health records. That accelerated adoption and allowed us to capture more market share more quickly than when we were just selling without government subsidy.
Was that meaningful use back in
Yes,
like 2012? Yeah.
yes.
Yeah.
You're kind. Some people have called it meaningless use, but we'll leave
Well,
that
look, it,
to
it worked for what it tried to do. It just didn't necessarily think about some of the unintended consequences, which is true for all regulation.
yeah, yeah,
But there was
exactly.
wide adoption, that's for sure.
And very quickly. And so, now in the current environment, there's pressures on healthcare costs, which may mean, to the point that you're making, you need to have more virtual care. You need to have more alignment of incentives around preventative care than what we've had before. I think that will be a good thing for the companies that we work with.
But can we get organized from a regulatory standpoint? I'm sort of suddenly reminded of a little anecdote I heard, the China-India comparison. Both incredible countries for similar reasons: scale, work ethic. Yet India seems wildly chaotic, and China seems quite organized in many ways. And big difference between the two is disparate regulatory system where every region has its own say, versus a federal system that really is quite unified. China being quite organized. You need a bridge is built. In India, you have an endless debate with different stakeholders, on that bridge, and it doesn't get there. And so I feel like America is more of an India model. Different states disagree on policy, and that affects national adoption of new tech solutions quite frequently.
I think we're seeing that play out a bit in artificial intelligence in terms of, states that are creating works around how it's going to be used. But I do believe that there are many more opportunities for greater degree of adoption, new reimbursement codes that will come forward around utilization of digital health solutions that will be positive on balance. I think there are other pressures, as we get into 2027 and individuals are losing coverage for healthcare, that will put different cost pressures
If you're
on
in
the
the gatehouse
system.
area,
And
can you hear
again,
at the podium?
demand for how are you going to be able to treat people. It's not like they're going to stop being sick, but if they've lost insurance, you're going to need to find ways to be able to treat those individuals or to
Dickinson,
find
if you're in
ways
the
to be
gatehouse
more
area,
efficient
please can
treating
you
the
hear at the
people who can't
podium at gate
afford it,
82?
so that you can now devote time to the individuals who are going to be showing up at your door who have the
Christopher Odit, if you're in the
ability.
gatehouse area, please see me here at the
So
podium at gate
technology can
82.
play a meaningful role there.
That is one of the unique aspects of healthcare is that it is required to treat those who can't afford it. And many industries, that's not the case.
Yeah.
It does make us quite special.
It is, and in some sense, although we fail to recognize it as such, it is a public good, right? And so it's just the models for how it gets paid for, are not fully aligned with it being a public good, and we live within that framework. It's not a political comment. It's just ones that you deal with the framework that you're existing in, and you try and find ways to optimize it and deliver better care to more people and do it in an affordable way.
What about one of my favorite risk bubbles in the world of venture capital, which is anti-competitive, monopolistic bullying by the incumbents, who invariably move slowly due to Christensen's innovator's dilemma. They just don't see the small moving dots. And then those dots move so quickly, they end up paying a price for their own success. You move too quickly and a large dinosaur will notice you. And I think of Epic, Allscripts, and Cerner as good examples of, large incumbents. It's not the only example, right? But good examples of large incumbents who are not really going to just allow their core EMR business to be disintermediated. And why should they, right? This is their business. They're going to protect it the best ways they know how. How does that, who better to ask than you what really goes in those closed rooms?
Well, look, there is a lot of innovation that's left on the cutting room floor. I think Epic, has probably done a better job than most in that space in terms of being able to provide guidance to their clients, listening to their clients and then understanding what some of the key needs are and how it's going to be adopted. They were very much a walled garden and to open it to other innovators. They were trying to provide those innovations on their own. Your point with regard to scribing, and they're coming forward with an offering for that, is a demonstration that they have never really done acquisitions. They haven't been a great corporate partner. They've tended to do some of that on their own. And others in the industry that built a more open ecosystem and play differently probably haven't achieved the same level of success and growth that Epic has in the larger institutions that really are relying on having them in place. Maybe stepping back because currently we don't invest in the healthcare information technology space for solutions that live inside health systems. What we've seen from a disruptive technology standpoint, your point about the innovator's dilemma, we keep coming back to it in this conversation, is a good one. In the case of AI, I actually think the incumbents, the large behemoths, as you mentioned, like Meta, Microsoft, Amazon, OpenAI, they're investing billions in the infrastructure that's required to operate those systems. And innovation will be built on top of those platforms, just like it was on the internet. There was a lot of investment that was put into building out that infrastructure, and then companies built on top of that and rode those rails. Use something that probably ages me here a bit. We invested in companies that used to buy servers. And as you tried to grow your business, you would need larger and larger server rooms, and you'd need data centers that you'd be operating in various environments. Now you can work with cloud computing companies and scale infinitely without having to go out and buy those servers. So what we see is AI is going to evolve in a similar way, that you'll be able to use some of those AI solutions in a manner that doesn't require you to go out and build your own language models, build your own data centers, and host it on your own. You'll be able to build on top of it. And
It
that will
sounds
create economies of scale.
sounds really compelling, so much so that we're building our own AI here at scale and selling it, relying on those larger Amazons to provide the infrastructure that we can then optimize or customize for our end users' benefit. The problem you run into, hopefully we won't run into this problem, is there are behemoths, but they're still giants. And you step on a giant as a new entrant. And it doesn't necessarily have to be Amazon. Epic is a $5 billion revenue business. Maybe I'm understating it. It still qualifies as a giant. And so you still have to be careful. It sounds very compelling. And I'm not the only one who feels that way. There are 100 different scribe AI solutions out there. And I think the first one came to market within the last 24 months. That's how quickly the market moves. But there's a perverse game theory, a sort of game theory run amok concept that we keep seeing, and I know you know this because you're a historian of technology, I can tell, that repeats itself, the cycle repeats itself every time. The doors open and everyone rushes in with a new solution, knowing as they're walking through the door that only a handful will survive. It's just a very interesting human condition that we continue to engage in.
Right. There was a statement made by GE many years ago that they would only go into businesses where they could be number one or number two in a market. And the way we look at things when we're evaluating companies is if the market is only large enough for one or two companies, we won't play.
Yeah,
in other words,
that's a good point.
We think, to another great comment you made earlier about the balkanization of healthcare here in the US, there's a meaningful amount of opportunity because a Mayo Clinic, doesn't necessarily compete with a university health system in Ohio. And so
a Cleveland Clinic.
So you've got opportunities to work with different areas, different states, different stakeholders in markets where you can still be very successful and build a very important company in various domains in the places that we invest without having to be number one, number two. I mean, look at all the mental health companies that exist in the marketplace. There are probably way more than what are needed, but yet there are a number of them that have been able to grow and scale because there's such market need and demand. There will be some small companies that will either get acquired over time or will run out of funding, and these larger companies will.
I love it. You're quoting Michael Porter, nursery pools to me, which I believe in fully because I lived through one myself. I founded what became the largest business of its kind, surgery centers in New York State. If it wasn't for New York State, we would not have survived. But New York actually created a lot of protection for our business. It kept all the national incumbents away from us. We would never have been able to compete with them if they were in our market. So that balkanization is essential for a lot of startups. They need that protection in order to get their footing, get a little bit of maturity under their belt. Lee, I want to thank you for your time today. I'm sorry that we did this with me in an airport, but I hope you appreciate and agree with me that it was well worth it.
Right, good to see you.
Thank you for joining us on Analyzing Healthcare. Stay informed and stay inspired. Don't forget to subscribe and visit scale-community.com to become a Scale Community member. Until next time, keep exploring the ideas that shape our healthcare systems.